Secours is celebrating a big anniversary this month, the 10th year of its adolescents and young adult cancer care program. Here to tell us more about this program and why it's so special, we have got Dr. Hal Crosswell and one of his patients, Iscella. Great to see you guys.
Nice to meet you.
Yes, thank you guys so much for being here.
Thank you.
Yes, talk a little bit about that AYA, as we'll affectionately call it.
Yeah,
what it means.
So AYA is the formal definition is an age range. It's a subpopulation of cancer patients 15 to 39 years of age. And in the United States, it sort of was first formally defined in 2006. And since then, there's been a growing effort across both the pediatric oncologists taking care of patients less than 15 years of age, and medical oncologists taking care of the older patients, to band together and develop unique programs and care models for AYA patients 15 to 39 years of age with cancer.
Yeah, and why is that so important? Because obviously, if we know anything about cancer, we know it doesn't discriminate about age or anything like that. Every family has a cancer story. But why is it important to, really target this age group?
There's a couple of reasons. It's a great question. One, historically, they've been the AYA population has sort of fallen through the cracks, both on what is felt to be some survival differences across certain types of cancers. And then the supportive care is unique for that age range. It seems strange to have a 16 or 17-year-old lumped in with a 36-year-old, but when you look at it developmentally, it's a life in transition from high school to college, or high school to work, or college to the workplace, or into parenthood, or new relationships. And that's in development as opposed to the typical age range of an adult cancer patient, 65 years of age.
Right.
One of the major reasons why we're having to band together is that clinical studies and clinical trials, we just don't know much about this population because one of the lowest rates of enrollments is in the AYA age range. It peaks in pediatrics, and then there's this cliff that falls off. So we just need to know more about the effects of cancer on young adults, and it's one of the main reasons why folks are trying to do this.
Well, so let's talk about the AYA program, how you were a part of it and what it's meant to you.
Well, I was diagnosed at 26, so that's how I met Dr. Crosswell.
26?
And yes.
Wow.
What kind?
Leukemia.
Oh.
Yes. So the AYA program is, like, what I've loved about it is just you get to meet people that are going through the same things that you are, and you get to actually like talk about it and have like a community to build on that. Because I mean, I didn't have anybody that I knew that had cancer, so I was like, how do I go along with it? Like he said, relationships, even like your jobs, financially, dealing with the financial stress of like going through the hospital system and stuff like that. So it was a lot, and I feel like the AYA program builds a big community that you can talk to people, and they help you in other different ways.
How did you find out? Like, how did you even go? Were you just like feeling crummy one day?
Oh no,
or?
Dr. Crosswell. He literally was like, there's also another program called First Ascent. He kind of threw me into all that. He was like, look, this is what we have. You should do this, join this, meet these people, and it's just a great community. And I also like that it's kind of a part of the healing process, helping other people that are going through the same situation that you were in and kind of being that person you needed. So that's what I love about it.
And Dr. Crosswell, you acknowledged this or alluded to this fact that, someone that's younger in their life would have other questions about longevity, about what that means for if they wanted to have kids and things like that. So there's so many questions that come out of this age range that doesn't come out of some of the other
You're
folks.
exactly right. There's when we talk about the effects of cancer, everybody wants to survive, right? And so the goals of AYA programs, and we're 10 years into it now, so that's one of the reasons why we're talking to you, is that we started this program in April of 2012. And since the AYA effort in the upstate has grown exponentially, so it's been incredible to see. But what we want to do is we want to start the survivorship from day one, and not just survive, we want to thrive through that. And so we think about, especially for the young adult, just like we do in pediatrics, we think about what's life after cancer, because the majority of AYAs are going to survive their cancer. And what we want to do is we want to get them through and make it a little fun as best we can, a little bit, but then set the stage for how they are going to, live the rest of their lives, post-cancer diagnosis, post-cancer treatment, and was unfortunately a number of side effects that come because of it. So.
And I've been in yoga classes with this one. She's thriving.
She's kicking butt.
She's thriving.
But how amazing to have people, because when you're going through something like that, sometimes you can feel all alone, that
Yes.
no one else understands. And wouldn't it be nice to be able to pick up a phone or send a text and be like,
Yeah.
did this ever happen to you? Is this like a normal side effect?
Yes.
Am I going crazy?
Yeah.
Okay.
Yeah.
Like it's
And
probably just
even an
reassuring.
emotional thing, because it's a big emotional journey
Yes.
going through it. And I did it like in my mid-20s when most people are getting engaged or married, and
Yeah.
it's like your life goes on pause. And to just be able to talk through it with somebody.
It's a huge mental impact, for sure.
Very huge
right?
mental impact.
So, doctor, if someone's sitting here watching this, if have they already been diagnosed with a cancer, or are they going through the process? Like, can they still be involved with these programs? How does that work?
Yeah, absolutely. Talk to Iscella. She's
I'm
the
7
poster.
years cancer-free, so
Yeah.
I'm still a part of it. And yeah, it's like in treatment and then post-treatment as well. We still
So it's
have
a full
meetings
journey.
and stuff.
Yeah, absolutely. And a major component is as much about the therapy, but it is about the support system, and that's why it's counterintuitive, and especially today's healthcare, which is so bottom line driven.
Right.
That the support staff that we have, the AOA coordinator, the research coordinator, to be able to bring trials here so AOAs don't have to travel, because many can't because they don't have financial ability to
Yeah.
travel, and the AOA life specialists, which a number of programs are developing, just like the child life specialists, are connecting these patients, reducing the amount of loneliness and the isolation that they find, and improving their ability to pay for the finances to cover that, and tapping into resources that giving communities like Greenville have, and not only here locally, but regionally and nationally.
Well, go bond Secours
Yeah.
for making this a priority and doing this. It's amazing. All the information right
Thank you,
there
guys.
on your screen. Dr. Crosswell, thank you so much.
Thank
Appreciate
you.
Iscella.
Thank y'all.